Bismillahirrahmanirrahim. Assalamu alaikum. A 32-year-old woman, Gravida 3 para 3, come to the office due to abnormal uterine bleeding. He was at age 13 and her menstrual cycle was monthly until a year ago. The patient then began to have irregular menses that occur every 45 to 60 days with heavy bleeding and passage of clothes but no cramping. She has not had a menstrual period for the last 4 months. The patient has not hot flashes, acne, or abnormal hair growth. She take levothyroxine for hypothyroidism and her only surgery was a tubal ligation after her last delivery. Height is 160 cm and weight is 120 kg. Speculum examination is normal and bimanual examination is limited by body habitus. Urine pregnancy test is negative. Laboratory results are as follows. TSH 2.9, prolactin 16, FSH 20. Which of the following is the most likely diagnosis in this patient? So this patient is 32-year-old woman. She came to the office due to abnormal uterine bleeding. Patient having irregular menses that occur every 45 to 60 days with heavy bleeding. She has not had menstrual period for the last 4 months and the patient weight is 120 kg. Speculum examination is normal and bimanual examination is limited by body habitus. So based on these hence diagnosis of this question is an anovulation, and here the correct option is choice B. This patient chronic more than 6 month abnormal uterine bleeding is likely secondary to excess adipose tissue associated with obesity. Excess adipose tissue affect the hypothalamic pituitary ovarian axis by two major mechanisms. The first one is obesity causes increased insulin resistance and hyperglycemia, which decreases the production of sex hormone binding globulin, causing elevated free androgen, which is androstenedione levels. And the second one is the increased free estrogen are aromatized in the adipose tissue to estrogen, which leads to persistently elevated estrogen level. These levels lead to effect gonadotropin releasing hormone from the hypothalamus, resulting in imbalance between LH and FSH level, which lead to anovulation. Come to the incorrect one, adenomyosis. So patient with adenomyosis typically have heavy monthly menstrual bleeding with dysmenorrhea. Choice C, endometrial polyp. So patient with endometrial polyp does not have an ovulation. Choice D, hypothyroidism. So the patient TSH level is normal, making hypothyroidism unlikely. Choice E, primary ovarian insufficiency. So primary ovarian insufficiency is menopause and women age less than 40, but patient will have vasomotor symptoms, for example, hot flashes, amenorrhea, acne, and insomnia. Choice F, uterine leiomyoma. So uterine leiomyoma, which is also called fibroid, causes heavy regular menstrual bleeding rather than irregular menses.